All right, so CMV, cytomegalovirus, or sometimes this is written as HCMV, so this would be human cytomegalovirus, or human herpes virus 5. This is exceedingly common, right? So depending on where you live, up to 80% of the people acquire this at some point in their life. In the United States, depending on where in the country, between 40 and 70% of us are seropositive for CMV. And for most people, it's asymptomatic or very mild. But remember, it remains dormant. Like all herpes viruses, it remains dormant in your body. And this is really important when we think about things like organ donation. If a person is naive to CMV, if they aren't exposed to it, and then they get an organ donation, and after you receive an organ, you're often on immunosuppressants to make sure you don't reject the organ. And if there's CMV in the donated tissue and you're on immunosuppressants, then you can get a very serious case of CMV, and sometimes that can lead to serious complications or rejection of the transplant, which could wind up killing you. This is also the one of the most common congenital birth or causes of congenital birth defects. So this is actually more common than listeria and toxoplasmosis, but most people have heard of that. This is an interesting sort of infographic here. So if you ask women, have you heard of these things, 98% of pregnant women have heard of Down syndrome, 62% have heard of listeria and toxoplasmosis, but only 33% have heard of CMV. And yet CMV actually causes more problems than Down syndrome, listeria, and toxoplasmosis. So if a woman is pregnant and she acquires CMV for the first time, then during that pregnancy, then the virus can cross the placenta and it can infect the fetus. And then the fetus can be born with deafness. This is the most common serious complication here. And this is the leading cause of congenital deafness. This can also lead to other defects or other disabilities, including epilepsy, their physical, motor disabilities, problems with vision, and other learning difficulties. So CMV is a really serious problem, a pretty common problem, and there's no vaccine for HCMV yet. And people have been kind of hoping that since they came out with the chickenpox vaccine, then maybe that a CMV vaccine would be next. But so far, we don't have one. So this is a problem for pregnant women and their fetuses, and this is a problem for people getting organ transplants. This is also a problem for people with AIDS or who other severely immunocompromised individuals, and this can lead to severe infections in the eye. So CMV is transmitted through close contact. Remember that all herpes viruses, except chickenpox, are going to be transmitted through close contact. And CMV is kind of interesting if you do some histopathology. It causes these inclusion bodies in cells, and that gives this kind of owl eye. That's the term, owl eye appearance, if you look at someone's tissue under a microscope. So this is found in bodily fluids transmitted sexually through breast milk, blood contact, and transplants. Now we're going to go through the life cycle of the herpes viruses in more detail a little later on, but briefly, right after it attaches to the surface of the cell, it's going to come in through endocytosis. You're going to have a pH-mediated conformational change in the glycoprotein that leads to escape from the endosome. And then it's going to take advantage of your cytoskeleton, and it's got some proteins, tegument proteins, that are going to help take advantage of your cytoskeleton, traffic to the nucleus. Herpes viruses are going to replicate in the nucleus. They're going to assemble in the nucleus, and then they have to leave the nucleus. And they actually have two envelopment stages. They're going to pick up an envelope at the nucleus, and they're going to lose it, and they're going to pick up another envelope from the Golgi, and then they're going to bud out through exocytosis. And so we'll revisit this a little bit later in more detail. All right. Epstein-Barr virus, or human herpes virus for EBV. So CMV, did I mention that this time? I might have forgotten to mention. CMV can also cause mononucleosis. About 20% of mononucleosis cases are caused by CMV. Epstein-Barr virus causes the other 80% of mononucleosis cases. And most people, kind of like with CMV, are seropositive for Epstein-Barr virus. Epstein-Barr virus is exceedingly common, and most people have a very mild case or asymptomatic, but some people get mononucleosis. This is also called mono, or the kissing disease. And symptoms of mononucleosis include sore throat, fever, swollen lymph nodes. You generally feel bad, and this can last a month or two. Now, if you have mononucleosis, you're often told that you have to avoid sports and you have to avoid physical activity, because sometimes this causes an enlargement of the spleen or the liver, and then if you get tackled, or you get thrown to the ground or something like that, then that can actually cause a rupture, of your spleen, which would be very bad. Now, Epstein-Barr is going to replicate in your immune cells, and so that's why you're going to get these really swollen lymph nodes, and other organs associated with your lymphatic system can be enlarged and swollen. Now, occasionally, Epstein-Barr virus integrates into the genome of B cells, or it causes a rearrangement of the genome in B cells, and this leads to a B cell lymphoma, and this leads to Burkitt's lymphoma. And so you can see this kid has received some treatment. They treat this with chemotherapy and so forth, and so this is when he was sick, and he's better now. This is far, far more common if you have a co-infection with HIV. So most people who get Epstein-Barr virus do not get Burkitt's lymphoma. But if you have a co-infection with HIV or malaria, you are much, much more likely to get Burkitt's lymphoma. And malaria happens to be endemic in the equatorial regions, and so in the equatorial regions, where you've got mosquitoes spreading malaria, you're much more likely to get Burkitt's lymphoma. Or if you have a co-infection with HIV, you're more likely to get Burkitt's lymphoma. Now, Epstein-Barr virus also has something of note that's kind of interesting here. There's a good deal of research now that Epstein-Barr virus might be a trigger for multiple sclerosis. Epstein-Barr virus, it appears, can activate some endogenous retroviruses. So there's a couple here. One is the multiple sclerosis associated retrovirus. So remember, endogenous retroviruses are ancient retroviruses that integrated into our ancestors' genomes a long time ago, and they picked up mutations over time, and they no longer produce infectious particles and spread anymore, but we still have those endogenous retroviral genomes in our genome. And occasionally, if you get infected with another virus, it can turn them on, and they think this is a big triggering factor for flare-ups of multiple sclerosis. There is no vaccine for Epstein-Barr virus. It's most cases, of mononucleosis are acute and self-limiting. Treatments for Burkitt's lymphoma are standard cancer treatments. You can't give antivirals to someone who has Epstein-Barr virus because, that has Burkitt's lymphoma, because after they have the cancer, the gene rearrangement in the B cells is already done. And so trying to eliminate the virus at that point wouldn't be possible. And this virus, again, like all herpes viruses, can remain latent in your B cells for life. All right, roseola and phantom, which sounds so much cooler than herpes virus 6 or human herpes virus 7. So this is 6 disease. Very, very common in children. Almost all small children get it. Both of my kids got it. Ian, my older one, it was much easier to deal with because he took medicine. Connor refused to take a medicine, and so his fever got really high and out of control, and we had to take him to the hospital. And then they told us about suppositories, and then that solved that problem. And then after that, he was much more amenable to taking oral medicine. It was amazing how that worked. But this disease, from a parent's point of view, is really odd because your kid's healthy, and then all of a sudden they get a super duper high fever, like 103, 104. And then for Ian, we gave him, they told us to alternate ibuprofen and acetaminophen, and that kept the fever down. He was still a fuss bucket, or a bucket of fuss for a couple days, but the fever was manageable. And then after the fever breaks, then they get this rash. And the rash doesn't really seem to bother them at all. And it's weird because you're like, whew, they're finally better. And then they're covered in this rash. And you're like, oh God, what's happening now? But they feel fine. At least my kids did. They felt perfectly fine with the rash. And just went about their day. Now, Connor, again, spiked a super high fever. And he wouldn't take oral medication. And so his fever got up over 105 by the time we got him into the emergency room, and they had to force medication down his throat, kind of like forcing a dog to take medication. And then, they told us to pick up suppositories on our way home, which we did. And then, so we managed to keep his fever down that way for a couple days. And then the fever breaks, and they get covered in this rash, and then they feel fine. Most kids get this, and most kids it resolves within a few days. Remember, it's a herpes virus, so it can stay latent your whole life, and this one stays latent in your monocytes. For most people, it does not reactivate. Reactivation is rare. But if it does reactivate, it can be severe. And so this is a problem, particularly if you have a compromised immune system. But for most people, after you get the fever and the rash as a small child, then you're better and you're over it. Okay, human herpes virus 8, or Kaposi's sarcoma herpes virus. So this virus, depending on where you live in the world, can be very common. So in the States, maybe 5% of people are infected with this or seropositive, and in other places in the world, upwards to 40% of the population is infected. And for most people, this is asymptomatic. For most people, they're seropositive, but they don't ever remember getting sick with this. And in areas where this is endemic, we think it spreads, again, through close personal contact, and can be spread from mother to child. This is present in oral and genital secretions, so this could spread through kissing. This could also spread through sexual contact. And then it goes latent, right? It stays latent in your body. And then when you get older, excuse me, when you get older and your immune system fails, then it can reactivate and cause cancer or sarcoma. Now, this is much more common in elderly men of Mediterranean descent, but they've also found that this is a lot more common in AIDS patients of any ethnicity. Because, again, your immune system is compromised. So really the only people who acquire Kaposi sarcoma are people in their 20s or 30s with AIDS, or elderly men of Mediterranean descent. And if you are otherwise healthy, they can usually treat this cancer. If you have AIDS, then sometimes this can be fatal. All right, Castleman's disease. Now, they're showing a really, really swollen lymph node here. This is not cancer. This is not like Burkitt's lymphoma, right? So this is not cancer. But this is extreme inflammation of the lymph nodes, so other lymph nodes in the body could also be very, very enlarged. So the enlarged lymph nodes are also accompanied with, very broad flu-like symptoms. This is a problem for immunocompromised individuals, right? So again, most healthy people are going to be completely asymptomatic. So herpes B virus is primarily an infection of monkeys, and this is really a problem for people who are handling the monkeys, so lab workers or zookeepers or anyone who's in contact with a lot of monkeys, or tourists who get too close to monkeys. And this can be very serious. It starts off with influenza-like symptoms, and then it can spread and become encephalitis. And this can be fatal a large percentage of the time. I think about half of the time that this is fatal. So this is pretty rare, but there is a reason that you should stay away from monkeys. So we're going to end part 2 here, and we'll pick up part 3, going into the molecular biology of the herpes virus structure, its genome, and its replication cycle.